The automatic doors hadn't finished opening when Serena Ashford was already moving. She'd heard the vehicle before she saw it, the hard break of tires on asphalt, the kind of stop that meant someone wasn't thinking about parking, just stopping. 6 years in emergency nursing had rewired the part of her brain that handled sound, and that sound, the one that said something is wrong and it's coming through that door, had pulled her to her feet from the nurse's station before she'd consciously decided to move. The German Shepherd came through the entrance first. He was wearing a military tactical harness, olive drab, rigid, with Army stenciled in blocky letters across the back panel, and he was listing badly to the left, his hindquarters not quite tracking with his front, leaving a thin, dark smear on the linoleum with every step. Behind him, holding the leash with both hands, was a young soldier in a uniform that had seen better hours. He had a field dressing wrapped around his left forearm, dark at the center, and his face was the color of old wax. But he was standing and he was walking, and in the triage logic that lived in Serena's marrow, that told her the dog was the one she needed to reach first. She dropped down to a crouch before she'd cleared the desk. The shepherd turned his head toward her. His eyes were brown, and they were glassy with pain, but they were present, tracking, watching, aware. There was a name tape on the front panel of the harness, just below the chest buckle. Ghost. "How long ago?" she asked, pulling on a pair of gloves from the wall dispenser without looking up. 40-some minutes. The soldier's voice was controlled, engineered, the way only trained people sounded when they were fighting not to fall apart. ID on Route 7 near the Rockfish Gap turnoff. He went ahead. That's what he does. He caught it early, and he turned back, and the shrapnel caught him on the left side when it went. I dressed it in the field. The vet clinic in Albemarle is 45 minutes out, minimum. I know. Serena was already running her hands along Ghost's left flank, feeling for the wound site beneath the vest. "What's your name?" "Corporal Lennox, ma'am. Devin Lennox. Ghost's assigned handler is Staff Sergeant Hale. Sergeant Hale is being treated at the site. I have authorization to make decisions for Ghost in the field." "Okay." She found the injury, 2 penetrating wounds, left lateral abdomen, the field dressing blood-soaked at the center and holding at the edges. "Okay, let's get him somewhere I can work." She knew what she was doing, sat outside the formal boundaries of her license. She was a registered nurse, not a veterinarian or a vet tech, and Millbrook Regional Medical Center in Waynesboro, Virginia, was a human emergency room. These were facts she carried, filed somewhere in the regulation-aware part of her mind, and right now that part of her mind was very, very quiet. Because Ghost was looking at her, and Ghost was bleeding, and the 45-minute drive to Albemarle was 45 minutes Ghost did not appear to have. She'd grown up on a farm in Rockbridge County, 22 miles south of here. Her father had run cattle and kept working dogs, and she'd watched him clean and dress a border collie's torn shoulder on their kitchen table at 2 in the morning when the nearest emergency vet was closed, talking her through it the whole time in the calm, instructional voice he used for everything that mattered. She'd been 12. She'd held the flashlight. She'd never forgotten what he said about pressure. "You don't guess with a bleed, Serena. You commit." The 2 orderlies on duty, Marcus and Teague, both newer to the floor, both watching her with the wide, still eyes of people waiting to be told what to do, helped her get Ghost onto a lowered gurney and wheel it into Bay 2. She cut away the section of the harness around the wound site with surgical scissors and worked through her assessment with the focused efficiency that 6 years of trauma nursing produced automatically, even when the patient had 4 legs and a tactical vest. 2 lacerations. The superficial one had already begun to clot. The deeper wound, and it was deep, she could see that now, was still seeping steadily beneath the field dressing. The gums, when she checked them, were pale pink edging toward white, heart rate elevated, respirations shallow but rhythmic, capillary refill sluggish. She started an IV line. It took her 2 tries and 30 seconds, working around fur and the unfamiliarity of the anatomy, and when she got it, she felt the same sharp satisfaction she felt every time she got a difficult line in a human patient, the click of competence that never entirely went away, no matter how many times you did it. She was running fluids and repacking the deep wound when the voice came from the doorway. "What is going on in here?" It wasn't a question, Noreen Vaught never asked questions when she could make declarations. Serena had worked at Millbrook for 4 years and had spent the better part of 3 of them navigating around Noreen Vaught, who was the Director of Patient Services and had held that title for 9 years, and who ran this hospital's administrative apparatus with the precision and personal warmth of a parking enforcement officer. She was 61, had never worked a patient floor in her life, and had the specific confidence of someone who had long ago decided that authority and competence were the same thing. She was dressed in civilian clothes, gray slacks, a dark blazer, which meant someone had called her at home. At this hour, that meant she was already angry before she'd walked in. "I'm managing a hemorrhage," Serena said, without turning around. "That is a dog, Nurse Ashford." "Yes." The click up heels on linoleum. Vaught moved into the bay, positioned herself at the edge of the gurney in Serena's sightline. "Step away from the animal, immediately. He'll bleed out within the hour if I do. That is not a concern that falls within." "With respect, Director." Corporal Lennox's voice came from the wall where he'd been standing, quiet until now. "Ghost has a commendation from the Department of Defense. He's active duty military. I'd appreciate it if—" "Sir." Vaught didn't look at him. "I understand this is an emotional situation. We are arranging transport to a licensed veterinary facility as we speak. But this nurse is operating outside her scope of practice and outside this institution's. He doesn't have time for transport." Lennox said it the way soldiers said things that should have been obvious. "Ma'am." Vaught turned back to Serena. Her voice dropped, became the kind of quiet that was worse than loud. "Nurse Ashford, I'm going to tell you one more time. You will step away from the animal, or I will terminate your employment effective immediately and have security remove you from this building. Your choice." Serena looked up at her. She looked at Ghost, who had turned his head at the sound of raised voices, who was watching the room with the careful, tired attention of an animal that understood more than it could say. She looked at the monitor she'd clipped to his ear, heart rate 140, oxygen sat at 91 and holding, not dropping. She looked back at Noreen Vaught. She thought about how many times in 6 years she'd bent herself around what Vaught wanted, how many incident reports she'd softened, how many opinions she'd kept to herself in conference rooms and staff meetings, in the interest of the institution and professional continuity, and all the other phrases that meant, "Don't make trouble, Serena." "Then do what you need to do," she said, and went back to work. The silence lasted 2 seconds. Then Vaught stepped away and made a phone call. By the time Serena had the deep wound irrigated, packed, and properly dressed, 2 security guards were standing in the doorway. She was aware of them the way she was aware of everything in that room. Peripherally, fully, with the strange doubled clarity that adrenaline sometimes gave her. She could hear Vaught behind her, dictating the formal language of a termination into her phone. She could hear Lennox's sharp, low voice trying to interrupt and being talked over. She could hear Marcus breathing too fast near the supply cart, the way young staff did when they were witnessing something that scared them and didn't know what to do with their hands. When Ghost's vitals had stabilized enough that she could step back and feel the moment when the crisis became a recovery, she straightened up, pulled off her gloves, turned around. She unclipped her badge from her scrub pocket and set it on the tray table beside the gurney, between the scissors and the crumpled gauze wrappers. She looked at Teague, who was staring at her with the expression of a 23-year-old trying not to say anything that would get him fired too. "Keep pressure on that for the next 20 minutes, she said. "Don't let up, even if it looks like it's stopping, and watch his gum color. If it goes white, you call me." She paused. "Or call someone, but watch the gum color." Teague nodded, rapid and serious. She walked out through the main entrance. Not the staff exit. They took her through the main entrance, past the triage desk, past the waiting room, where 7 people at various stages of their own emergencies looked up and watched a nurse they'd never seen before walk past with a security guard on each side. She kept her chin level. She kept her eyes forward. She had walked alongside enough patients making difficult walks that she knew the posture for it. The November air was a shock. It was 41 degrees and she had no jacket. Her jacket was on the hook behind the nurse's station, her car keys were in her locker, and her phone was charging on the counter in the break room. She had her sneakers, her scrubs, and the approximate $11 in the right-hand pocket that she'd been meaning to put back in her wallet for a week. She sat down on the patient bench outside the entrance. The parking lot was mostly quiet at this hour. A few cars, the lights of the ambulance bay to the left, the sound of the highway in the distance, that constant low wash that you only noticed when everything else stopped. She sat there and she thought about nothing useful for a while. She thought about her nursing school clinical rotations, about the first code she'd ever run, about a woman named Doris from Staunton who'd grabbed her hand during a procedure once and told her she had steady hands like her grandmother, which had been the nicest thing anyone had said to her in a month. She thought about whether Ghost was going to make it through the night. She sat for 11 minutes. Then the doors opened and Teague came out with her jacket, her keys, and her phone, holding them out to her with the careful formality of someone who had technically taken an unauthorized bathroom break. He didn't say anything. He went back inside. She sat a little longer. Her phone had 14 notifications, 6 texts from colleagues, 2 from her mother, 3 from a number she didn't recognize, 1 from her landlord about the parking spot she'd been meaning to sort out for a month, and 1 from Corporal Lennox, who had apparently obtained her number from the intake system in a way that was probably a gray area. He's stable. Still fighting. Thank you, ma'am. She put her phone in her pocket and drove home. What Serena didn't know, because there was no reason she would, was that Ghost's service record was not the ordinary kind. He'd been deployed twice before this stateside posting, once for drug interdiction operations, and once as part of a ranger unit operating in Kandahar province. His handler for the past 4 years, Staff Sergeant Curtis Hale, had once told a reporter in a base newspaper interview that Ghost could read a situation better than most people, which was not hyperbole, and which Hale hadn't meant as a compliment to the dog so much as a gentle observation about people. 18 months ago, on a mountain road outside a village in Kunar province, Ghost had broken his heel command. In 4 years of working with Hale, he had never done this, not once. It was the kind of thing that happened in training videos, in the before and after scenarios used to justify MWD programs to congressional oversight committees, but in the field, in real conditions, you didn't count on it. You hoped, and you trained, and you ran the drills, and mostly what happened was the world anyway. Ghost had stopped, turned around, and looked at Hale with an expression that Hale later described as telling me something, and Hale had frozen, raised his fist, and the 6-man column behind him had stopped in place. The IED was 2 feet ahead of where Ghost had planted his paws. All 6 men had walked away. One of them, a 24-year-old corporal from Beaufort, South Carolina, named Edward Corrigan, had borrowed a satellite phone that evening and called his father to tell him he was alive and why. His father, who was currently assigned to Army Training and Doctrine Command at Fort Eustis, had listened to the whole account twice, and then sat very quietly for a long time before he said anything. His name was Brigadier General Alan Corrigan, and Waynesboro, Virginia was 2 hours and 9 minutes from Fort Eustis, which he knew because he had looked it up at 6:15 that morning after a call from Corporal Lennox. Noreen Vaught arrived at her office at 7:53, made herself a coffee, and was reviewing the final draft of Serena Ashford's termination paperwork when her assistant appeared in the doorway. "There are military vehicles in the front lot, Director." Vaught looked up. "How many?" "Several." She went to her office window. The parking lot was visible from the 3rd floor, and what she could see in it, parked directly in front of the main entrance, not in the visitor lot or the designated drop-off lane, but directly in front, taking up the spaces marked for hospital administration, were 4 vehicles, 2 black SUVs and 2 military trucks, as she watched the doors opened. 8 soldiers in ACUs arranged themselves in a loose line on the front walkway. Behind them, a man in dress greens walked toward the entrance with the unhurried posture of someone who had never needed to hurry because things arranged themselves around him. Beside him, on a leash, moving slowly but moving, was Ghost. Vaught's coffee cooled in her hand. She met them in the lobby because there was no other reasonable option. Her HR director was a half step behind her. Her legal counsel was in her earpiece, telling her to listen before she spoke and to document the interaction thoroughly. Brigadier General Corrigan was 60 years old, with gray at his temples and a chest full of ribbons that would have taken Serena 10 minutes to read. He wasn't loud. He didn't introduce himself. He looked at Vaught with the calm of a man who had long ago stopped needing to perform authority for anyone. Director Vaught, I spoke with Corporal Lennox this morning. He gave me a complete account of what happened in Bay 2 last night. General, I want to assure you that this facility has the deepest respect for military working dogs, and I'd like you to tell me, in your own words, why you terminated the nurse who saved Ghost's life. Vaught kept her voice measured. The nurse in question acted outside her licensed scope of practice. This facility's regulatory obligations require. My son was on that road in Kunar Province 18 months ago. Corrigan's voice did not change. He placed the sentence in the lobby the way you placed a document on a table, deliberately, without flourish. Ghost detected the device that would have killed him and 5 other men. Edward called me from a satellite phone that night. He was 24 years old and he was alive because of this dog. He looked at her. Ghost was brought to the nearest facility last night with a life-threatening wound. A nurse in this building stopped that wound from killing him, and you fired her for it. The lobby was very quiet. There were nurses at the station who were not typing. There were patients in the waiting area who were not looking at their phones. I've been in contact with Senator Brierly's office, the general continued. I've spoken with the State Health Department's Director of Emergency Services, and I've asked our public affairs officer to finalize a statement on Ghost's service record for release to the press, which will include a full account of last night's events at this facility. He paused. I'd like you to reinstate Nurse Ashford today, without any notation on her record, and I'd like this hospital to develop a formal protocol for emergency treatment of military working dogs, with her input. Vaught's legal counsel said something in her ear that she didn't fully process. She stood in her lobby in front of 8 soldiers and a decorated general and a dog who had survived the night because of a nurse she'd escorted out the front door, and she looked at the faces of her own staff, at Deb, who had worked nights for 11 years and who was watching her from the nurse's station with an expression that said everything she was professionally obligated not to say. And she understood, in the particular way that came from having spent a career calculating outcomes, that this was not a negotiation. I'll make the call, she said. Serena's phone rang at 9:14. She was at her kitchen table in her apartment on Maple Street, in front of a bowl of cereal she'd stopped eating. She looked at the number, which she recognized, and she sat with it for 3 rings. She picked up. Vaught's voice was careful the way asphalt was careful when it was still warm from being poured, smooth on the surface, yielding just slightly if you pressed. She offered reinstatement, full back pay for the shift, no record notation. A formal protocol review process in which Serena's input would be formally solicited. Serena looked at her cereal. Is Ghost alive? She asked. A pause. Yes, the Army's vet specialist confirmed this morning that he's expected to make a full recovery. She thought about Bay 2. She thought about Ghost's eyes, brown and glassy, tracking her across the room. She thought about Teague bringing her jacket without being asked, going back inside without saying anything, because that was what you did when the work was the work, and the work had to continue. I'll be in at noon, she said. She walked through the main entrance at 12:03. Her badge was at the nurse's station. Someone had set it on the desk facing up, which was not where she'd left it, and meant someone had handled it, and the only reason she could think of for someone to handle a terminated employee's badge was to have it ready for when that employee came back. She clipped it to her pocket. In the far end of the lobby, near the windows where the midday light came through at a low winter angle, Ghost was on a flannel blanket someone had brought down from pediatrics. He was lying on his good side with his bandaged leg extended, Corporal Lennox in a visitor chair beside him, the two of them occupying the space with the particular quiet of people, of beings, who had been through something the night before and were still sorting out what it meant. When Serena came through the doors, Ghost raised his head. He watched her cross the lobby. When she crouched down beside him, same crouch she'd dropped into in the ER entrance 15 hours earlier, he pushed his nose into her palm. She sat with him for a while. She didn't say much. Lennox told her that Ghost's rank was staff sergeant, which made him the senior enlisted soldier in the room over his own handler. He told her that the Army's provisional MWD emergency protocol, if it got written, would likely be named after Ghost. He told her that Edward Corrigan was driving up from Fort Bragg when he got leave approved, sometime in the next few days, and that he had specifically asked to meet the nurse. Serena didn't say anything to that. She scratched gently behind Ghost's ear, the good one, the one on the side that hadn't caught shrapnel, and he leaned into it with the solemn, contented weight of a dog that had done hard work and knew it, and was prepared to accept, for now, the small reward of a warm hand in a quiet room. She stood up. She picked up her badge and clipped it to her chest pocket, the same motion she made every shift, the small ritual of beginning. She walked to the nurse's station and picked up the first chart in the rack and looked it over and looked up at Deb, who met her eyes for a moment and then looked back at her screen and pressed her lips together in the way that meant everything was fine, actually, and could she get back to her documentation. Serena went back to work. The automatic doors opened and the morning's business moved through them. A man with a wrist that didn't look right, a child with a fever, an elderly woman who had been having chest pains for an hour before her daughter convinced her to come in. The ER did what ERs do, which is keep moving, keep the line moving, keep the next thing from becoming the worst thing. And Ghost slept in the November light, his chest rising and falling in the steady rhythm of an animal that had decided, for now, to rest because someone had stayed in the room when it mattered and the night had turned out the way nights sometimes do, improbably, stubbornly, against the reasonable odds, into morning.